Hi everyone, this is Dr. Devin Barley with Greenwich Chiropractic, and in this video series we've been talking a lot about specifically low back disc issues. And we know that 80% of people in their lifetime will experience some level of low back pain. And when we talk about disc issues, they're really at the serious end of the spectrum. And so what we want to make sure that we're doing is pulling in expert opinions and help to be able to do that. So today I have Jason Ulysses. He's with Specialized Orthopedic Physical Therapy. They have an awesome facility here in Warwick and in North Kingstown. And they have been in the practice for years and years and years. They're by far the best PT in the state. And so while we've been talking about low back disc issues, the main thing that we're going to be talking about are 3 simple exercises that you can do at your home to be able to relieve some of the tension. Of course, it's always best to get a second opinion from a professional, but if you want a little bit of agency at home, these exercises are going to be the best thing for you. So Jason Ulysses, thanks so much for being here. We appreciate it.
Thank you for having us here today, Devin. We're looking forward to this. So,
Absolutely.
hello everybody. So as Dr. Barley was saying, if you feel like you might have a bit of a disc problem, these 3 exercises we feel are very helpful when we're talking about maybe trying to help push that disc or pull that disc back into place relatively quickly. So I'm going to keep it very simple for you. First exercise, we call a prone press up, but we're going to start on a prone on elbows position, and then we're going to work into a prone press up. Okay, and the way that that's done here is you can do it on the floor, on a table, anything like that. You want to start here, and all you're going to do is you're just going to be on your elbows here, okay? And what we're looking for is we're looking for a little bit of arch in the back. Let your hips rest on the table or the floor or even your bed. If that feels comfortable to you, then what we recommend you do is you bring your hands underneath your shoulders like you're gonna do a push-up. Your hips are gonna stay down, and you're just going to gently push up this way until you feel a nice arch in your spine. Some people can't go as far as this. If you can't, just go as far as you feel comfortable. Come back down after about 5 or 10 seconds, and then you can repeat it again, okay? And usually we recommend doing 5 to 10 of these at a time, and a lot of times people will get a reduction in symptoms, reduction in any sort of pain in their legs. If that's happening, that's a good thing, okay?
And I think what's important about this exercise is what we find is that a lot of times when you have a disc injury, a lot of it stems from bending over or twisting and not thinking about your posture and picking up something heavy while you're twisting. So this exercise is really great because what we find is that it's actually the opposite of the mechanism of injury. So go ahead, Jason.
Great. So next, what we're going to do is we're going to go into what we call a quadruped position. Okay, that's just on your hands and knees. Okay, we're going to do a very simple movement of just called a cat-cow. What we're trying to do here, Dr. Barley, is we're trying to get some segmental movement going on in the lumbar spine itself. Okay, so first you just let your back arch, let your hips roll back a little bit. See, I got a nice arch in my spine here, and then you're going to roll it up. Okay, this is more that flex position that you were just talking about that we oftentimes injure ourselves in. And then we just want to go back and forth. All we're trying to do is get a little segmental motion going, lube up the joint, so to speak, and just get those spinal segments moving a little bit because we don't really want them to freeze up too much. Okay, so it's a nice thing. I feel most comfortable in this extension position. My back likes a little bit of extension. So.
And I think you just hit the nail on the head. You definitely want to be doing what's comfortable for you, right? We don't want to be kind of pushing through pain before we get evaluated. But if you find that one of these positions is more comfortable for you to do, then you want to lean a little bit more in that position and maybe shy away from the other position. But great advice, Jason.
And then lastly, we have, again, in the same position, okay, I'm just going to move up a little bit. What we're going to do is we're going to do a very simple core stability exercise, okay? So what you want to do is you want to kind of find that midpoint. You don't want to be too arched, you don't want to be too flexed. So you're kind of getting this nice midpoint here, a little bit of arch in the back. And then what you're going to do, I'm going to start with the simplest of movements, is just lift one arm, okay? And then you can come back down, lift the other arm, okay? It's a little bit of a core stabilization exercise. You want to keep everything nice and quiet and still. If that's easy, then you can go into lifting your leg out straight behind you, okay? And then you can lift to the other side as well. And then if you're still feeling good and you want to be crazy, then you can lift an arm and opposite leg at the same time. Again, trying to hold that position. And then switch to the other side. Okay? This is a little bit more in the strengthening realm. And whereas the other ones were more in the kind of like, just trying to get some movement and some stretching and stuff like that. That last one with the quadruped exercise, that's more of a strength exercise, which is really good to help keep the disc where it needs to be while you're doing dynamic movement.
100% awesome. And I think what's really important about these exercises is when they're prescribed by a physical therapist such as Jason or any one of his staff, we're always keeping safety in mind. So safety is going to be number one. And I think what's also important is that, especially with that last exercise, is creating that core stability is going to create lumbar spinal stability or low back spinal stability, which will help over time take some pressure off the discs. So thank you so much, Jason.
Yeah.
Appreciate it.
Thank you.
You heard it from the
Appreciate it.
expert here, Jason Ulysses with Specialized Orthopedic Physical Therapy. If you know anyone who's suffering from a low back disc injury, please get in touch with my office and with Jason. We'd be happy to co-manage your care. Thanks so much for listening. We'll see you next time.